Okay, good day guys. So, ang topic natin ngayon is about IMCI, Integrated Management of Childhood Illness. So, number one question is about a child with ear problem should be assessed for the following except. So, kung titingnan mo yan, A, B, C, and D, so, ang naiba lang dyan is there any fever? So, except po yan. So, ang sagot natin is letter A. So, kung may ear discharge, if discharge is present for how long, and ear pain. So, ang topic natin dyan is about mastoiditis. So, dun sa mastoiditis, meron din tayong tawag doon, yung acute at saka yung chronic ear pain. Okay? So, next question tayo. So, next question is if the child does not have ear problem using IMCI, so what should you do as a midwife or nurse? So, wala daw siyang ear problem. So, ang sagot natin dyan is go to the next question. So, letter D. Okay, so check for malnutrition. Pero dun sa updates, meron tayong dinagdag na after malnutrition, meron yung check for HIV. So, yun mong updates natin. Okay? Then, next question is sana yung next question natin. If the child does not have ear problem using IMCI, what should you do as a midwife? Okay, so go to the next question. Check for malnutrition. Okay, next is an ear discharge that has been present for more than 14 days. Okay, yung keyword natin dyan is more than 14 days. So, pag sinabing more than, so dalawang pagpipilian natin, chronic or acute. So, ang sagot dyan is chronic ear infection. Pag sinabing acute ear infection is less than 14 days. So, yung mastoiditis, ang definition niyan is swelling beyond the ear. And so, tandaan, ang keyword natin dyan is 14 days. Okay, so next question ulit. Number 4. Hintayin lang natin yung number 4 doon pala sa acute ear infection, meron dong ear pain. Okay? Next, number 4 is an ear discharge that, ito yun, less than 14 days. So, ang sagot dyan is acute ear infection. Okay? Usually, pag mayroon siya ganyan, ang ginagawa lang natin, bibigay ng pag may ear pain, di ba, paracetamol. Pag may fever, paracetamol din. Okay? Discuss pala natin yung yung color coded approach natin. Pag sinabing pink or red, yun yung urgent. Tapos pag sinabi naman na yellow needs an appropriate antibiotic or oral antimalarial, mga ganun. Tapos pag sinabing green naman, so home treatment tayo dan. Okay? Child does not need specific medical treatment. It includes home teaching to mothers. Okay, next question, number 5. Okay, so ang question natin dyan is if the child has severe classification because of ear problem, what should you be best things that you as a midwife can do? So, ang sagot natin dyan, number 5 is refer urgently. Okay, mayroon kasing severe classification. Pag sinabing severe classification, meron siyang Cuba. Ano yung Cuba? C is for convulsion, unable to drink. Pag sinabi naman B, vomits everything, and A is abnormally sleepy. Ito yung mga danger signs natin. Okay, meron siyang danger sign. So, ang sagot dyan is refer urgently. Letter B. Okay, next, number 6. So, yung situation natin dyan sa number 6 is, if the child with diarrhea registers one sign in the pink row and one in the yellow row in the IMCI chart. So, we can classify as, so pag sinabi natin, meron daw siya sa isang pink and one in the yellow. So, yan is some dehydration. So, itong topic natin ngayon yan is dehydration. So, yung dehydration, meron tayong classification. No dehydration, some dehydration, and severe dehydration. Okay? So, number 7, ang sagot dyan is letter B. Give oral every 4 hours. Okay? So, ang keyword natin kasi is which of the following is not included the rules for home treatment. So, yung home treatment natin is continue feeding the child, know when to return. Ito yung natin, plan A. Sa sa dehydration, meron tayong mga management, plan A, plan B, at saka plan C. So, pag sinabing plan A is sa home ginagawa. Tapos, pag plan B, ito yung sa RHU, pero pag plan C naman is dun sa hospital. Okay, number 8. So, ang sagot dyan, number 8 is persistent diarrhea. Okay? A child who has had diarrhea for 14 days but no signs of yun, ang keyword natin dyan is no signs of dehydration. Tapos 14 days din. Pero pag sinabi siya ng may sign of dehydration, severe persistent diarrhea ang sagot. Okay? Ano naman yung dysentery? So ito naman yung blood in the stool. So ang treatment natin dyan is ciprofloxacin for 3 days. Okay? So next question is number 9. If the child has sunken eyes, drinking eagerly, thirsty, and skin pinch goes back slowly. So yung classification natin dyan sa dehydration na yan, okay? So meron tayong severe, some, and no dehydration. Yun lang yung tatlong yon. Okay? So, ang keyword natin is goes back slowly. Pag sinabing very slowly kasi may iba yan. So, pag sinabing back slowly, goes back slowly, ang sagot dyan is some dehydration. Letter C. Number 9 is letter C. Letter C, some dehydration. Okay, next, number 10. So, Carlo has had diarrhea for 5 days. There is no blood in the stool. He is irritable. His eyes are sunken and offers fluid. So, goes back slowly pa rin. Okay, goes back slowly. So, ang sagot dyan is some dehydration pa rin. Okay? So, pag sinabing some dehydration, ang management natin is plan. Okay, plan B. Pag no dehydration, plan A. Pag severe dehydration is plan C. Okay, next question is number 11. What should an RM or NR do if a child has any general danger sign? Okay, pag sinabing any danger sign, meron siyang Q A. Okay, Q A. Ano yung C? Convulsion. Okay, so ang sagot dyan is refer urgently. Yung C is convulsion, yung U is unable to drink. Then, yung V is vomits everything. Then, abnormally sleepy. Okay, next is number 12. Okay, question is the following are example of danger sign except yan, titingnan mo lang yung Q ba dyan. Kung wala, okay, yun na yung sagot. So, ang sagot dyan is fast breathing. Okay, sa fast breathing natin, depende sa ilang buwan. So, meron tayong less than 2 months, tapos 2 to 12, and 1 year to 5. So, pag sinabing 1 year to 5, 40. Yun yung cycles per minute niya. Tapos, pag sinabing 2 to 12, yung 2 to 12 months, 50 na naman ang cut-off natin. Pag sinabing less than 2 months, 60 cycles per minute naman yung cut-off natin doon. Okay? So, next question is 13. A young infant aged 2 months will assess as a fast breathing if. So, ang sagot natin dyan, sinabi natin 2 months. 2 months. Okay, fast breathing. So, ang cut-off natin is 50. So, breathing for 50 minutes. Letter A. Kasi yung less than 2 months kasi is 60. Okay? Sa IMCI para meron tayong dalawang clients. Ito yung young infant at saka sick child. Okay? Next question is about number 14. You will classify as a severe pneumonia if a child has that following signs. Okay? Anong meron number 1? Any danger sign? Meron ba siya? Yes, meron. 2. Chest in drawing? Meron ba siya? Yes, meron. Tapos number 3, stridor in a calm child? Meron ba siya? Yes, meron. So, number 4, cough and colds? Wala siya. Number 5, wala din siya. So, ang sagot dyan is 1, 2, 3. Pero sa updates natin, 1 and 2 na lang ang sagot. Pero walang 1 and 2 dyan. So, ang sagot dyan is letter B. Boy. 1, 2, 3. Okay, may danger sign siya, may chest in drawing, at saka stridor. Okay, pero ngayon, yung updates, wala na po siyang stridor. Next question is number 15. If the child has pneumonia, you will advise to have follow-up check-up for how many days? Okay, yung old natin is 2 days, pero yung updates is 3 days. Okay? 3 days and 2 days. 2 to 3 days, pwede na yan. Okay, next question is about safe remedy. Pneumonia. Okay, next. Which of the following is a safe remedy to soothe the throat and relieve the cough? Okay, sinabi ng mga CI natin doon, mga teacher natin noon, ang tamang sagot dyan is breast milk. Okay, pag walang breast milk, sunod na pwedeng sagot, calamansi juice. Okay, so ito yung pinaka-safe na dalawa, calamansi and breast milk. Yung cough syrup at saka codeine, yun po yung unsafe. Okay, pag tinanong na unsafe, yan, cough syrup at saka codeine. Okay? So, next question is about pneumonia pa rin. So, sabi dito, if coughing for more than 3 weeks. Okay, so what should you do as a nurse or midwife? Refer urgently ba? Or refer for assessment of asthma or TB? Give inhaled bronchodilator? Or follow up immediately? Okay, so 3 weeks na kasi. Kaya matagal na yun. Matagal na. 3 weeks. So, ang sagot dyan is refer for assessment of asthma and TB. Okay? TB. So, usually, pag ginagawa dun, nire-refer, pwedeng x-ray, tsaka yung tuberculin test, manta test. Okay, next, number 18. If a child with no pneumonia, so cough and cold lang meron, is being treated with wheezes. So, advice to return after, 2 to 3 days po yan. Pero merong 2 at saka 3. So, yung old kasi, ang nakalagay is 2 days. So, yung new, meron siyang 3 days na. Okay? So, okay, depende na lang kung sino yung gumawa ng question na yan. Kung ano sinagot. Updates na lang. Yun sa 3. Okay. Next question is about diarrhea. Number 19, diarrhea. So, diarrhea is being classified into the following except. Okay. So, yung diarrhea natin, classify siya as severe dehydration ba? Blood in the stool, diarrhea for 4 more than days, or dehydration. So, ang sagot natin dyan is severe dehydration. Except yan ha. Kasi doon sa dehydration, may classification yan na 3. No dehydration, some dehydration, at saka severe dehydration. So, yun yung letter A. Tapos yung letter B, diarrhea for 14 or more. So, ang meron tayo dyan is yung persistent at saka yung severe persistent. Tapos yung blood in the stool, ito yung dysentery. So, A, B, C. Okay, meron dyan. Pero, ang except natin is severe dehydration. Under kasi yan ng dehydration. Okay? Next question is number 20. The treatment for severe dehydration is severe dehydration. Pag sinabing severe dehydration is plan C. Okay? Yung SAM is plan B. Tapos yung A is home treatment. So, pag no dehydration, home treatment. Tapos, pag SAM dehydration, yung Oresol. Okay, sa RHU na yan ginagawa. Plan B. Okay, tapos yung sa plan C, okay, pwede rin sa, ano yan, usually hospital na yan eh. Nag-IV tayo dyan. Okay. Or, pwede rin NGT pag wala yung IV. Okay, number 20. Number 20 na ba? Tapos na ata. Okay, so, thank you for listening and watching my video. So, please click like, share, and subscribe. Okay, good luck sa mga mag-exam. Thank you.